Our next presenter is Gurmeet Watan. Gurmeet is a psychologist, graduated from the Université de Montréal, has practiced in many settings and has specialized in bioethics at McGill University. She's become a consultant member to our clinical ethics committee, both at Elder Care and Maimonides, and will present from her perspective a response to what you've heard.
I asked to be last at this evening because what I wanted to share with you, I think sometimes this sense of doing an ethical analysis or something gets referred to the ethics committee, it's difficult if you're not right in it. I mean, before I went to school to do this, I didn't really know what was going on. And it sounds like somebody else is making decisions for us maybe, and where do we fit in this whole thing? So my goal today is really to share with you a little bit about what is it we look at, and maybe why our perspective, while it's somewhat different, it really tries to tie in together all the information. So I asked to be last because, as you'll see, first I need to understand the situation. So if a nurse would come to me, I say, let me go speak to the doctor, right? So let me read your notes, let me understand your situation, then let me understand. Because there will be things I don't know, like crisis. I have to look it up, learn more about it before I came here today. I would want to know what the law is in reference to this, and who has what right to make what decisions and what kind of intervention, right? And there's a number of other things. And I have to say, it doesn't hurt I'm a psychologist in this area also. Okay, so that's, all right, so this is the question, right? I think what you heard from everybody, and if that question came to me, I would rephrase some of it, okay? The second question said, does crisis prolong life, right? And the question is always, and this patient at this time, with this person at this time. And I think you heard the rabbi speak to that. There's cases where, you might make different decisions than in other situations. You heard Dr. Khan speak to that, and I'll refer to Mr. Kravitz as well. So the question is never, is crisis a good thing to do or not? It's now, for this patient. So, principle of medical ethics, there are, I didn't put them all up there, but I'm concentrating on 3, and you will see that it's reflected in the law, and these are duties that physicians are bound by. So it really all started with physicians who developed the Hippocratic Oath, and then, now we're all bound by this, right? I'm bound by this. And they're very, very significant, and people take them very seriously, okay? So I really wanted to go through that. Why is that? Because when a situation comes to us, this is what we're gonna go through. So I kind of want to give you a bit of a picture of what we go through when we discuss it. The respect for autonomy, it's exactly what Mr. Kravitz was referring to. The law and ethics is exactly the same thing, okay? We have a duty to respect the person's right to make own decisions. Now, this right is not absolute. You know that if you see somebody who's trying to jump off a bridge, you're gonna try to protect them and prevent them, right? So there are some boundaries there, but basically, when it comes to medical decisions, if a person is competent, they have a right to make the decision. Even if you don't agree, even if the child, the daughter, the son, the brother, the father doesn't agree, okay? I'm glad Mr. Kravitz went through this. I was sure you were gonna go through that about the legal, guardians. The interesting thing here that struck me, and I will come back to it later, is that when you discuss the PEG with the daughter or the son, she decided not to. She said, that's not what my father would have wanted to. But then there was a change of heart. And when it came to the crisis, she wanted it. So as a psychologist now, I'm going to put my head on and I'm going to ask myself, why the change of heart? Because if she started off saying, my father wouldn't have wanted it, and you see what's happening with the situation, that your father is, becoming more and more uncomfortable. It's making very clear. I think there seem to have been discussions explaining that this is not going to give him any better, I hate to use the word quality of life because we each have our own definition of it, but it's not going to restore any health to him. It's not going to make him more comfortable in the long run. And clearly he has been deteriorating. So why the change of heart? Which will bring us to the next slide, which is the next two obligations of physicians is, correct me if I'm wrong, Dr. Okay, is first do no harm, right? And then do whatever you can to benefit the person. And that's where the crux of the matter is. That's where the disagreements are. That's where the troubles are, because many times, in this case it may be a little bit more extreme, but many times it's not a very black and white thing. Because what one person considers a benefit, another person doesn't. That's why the living wills are different. That's why the advance directives are different, right? And as you say, some people say, it's okay, give me some more chemo, or even though, because, there's a wedding coming up, and I really want to be that for that. So yes, they did write an advance directive with you, Mr. Kravitz, but there are individual situations, and you can't foresee 2 years earlier or a year earlier what's necessarily going to happen. Okay, so these are kind of more broad kind of documents, and I think what we always say to people, talk to your family. The best thing is you have to choose somebody, whether it's your family or whether it's a friend or somebody you trust, to make decisions on you. Because what's on paper, it's kind of like, it's much more general than what happens in the bed, in the hospital, when you're there. So the best thing is really to talk to somebody you love, trust, to make the right decisions, and then they understand what you want under what situations, okay? So, so that is where the crux is, and this is where it's almost like we sometimes talk about the harm-benefit ratio. Now, these are not numbers. You don't do 10/5, but it's always trying to balance it, right? And that's the question here with this lady. I put this in red, obligations to the patient, because I think that in practice, it's very hard not to feel for family members when you have a mom or a dad in the situation. And it's hard not to see to family members' requests and feelings and say, okay, maybe just a little more, maybe just a little more. But as professionals, a physician, and nurses, it's hard, but I think sometimes you have to step back. Right? You have to make yourself step back and say, like, who is my patient, right? My patient is this person, and so over above everything else, that's the person I need to take care of. And where it becomes crucial is, I think sometimes it's hard, because I think sometimes when we try to discuss this with families, sometimes families feel, you don't care about me, but these are my feelings, and that's my mother. Well, yes, we do. Of course we do, and we try to support you, but our obligations to the patient. So now the question is about this particular patient. This is the question, assessing it at this time, the harms and benefits. So what are the questions if the situation comes to the ethics committee, where and it's not always because there's conflict between people, but really because people agonize over what might be the right way to go. What should we be discussing with families right now? Okay, this is what we ask. There's some of the questions we ask. Okay, what is the medical situation, the medical condition, and what's the prognosis? Okay, so we heard a lot about it, and we heard the prognosis. It is not good. It will include continuing suffering for this person, painful situation, okay? Given what we know, what should be our goals of care for this patient? And I highlighted goals of care because we often talk about treatment. But again, I'm going to refer to Dr. Akka as a physician and say my understanding is that the physician's duty is to look at goals of care. Treatment is part of care when it is appropriate, you know? So care includes comfort care. Care includes spiritual care. Care is a whole range of things. And this is what, when something comes to us and we have to consider it from an ethical point of view, we change the language. Like we wouldn't ask anymore what's the goal of this treatment. It's what's the goal of care for this person. And I think that in most cases, families will say, well, no, I don't want him or her to suffer. I want this person to be cared for. So we try to kind of rephrase it so that kind of we can have the same language that we speak about. And then we ask, okay, what do we know about what the father would have wanted? And that's why I bring up again that the daughter for the PEG said no and for the crisis said yes. So things are unclear, and I think that gives us a clue that we need to kind of explore that a little more and find out kind of what's really going on there. And maybe it's hard for the daughter to let go, and that would be very understandable. I think we all go through that. And then what would be the impact on the father of the treatments that are requested or they're possible? And I think we heard a lot about that, and we heard that it doesn't sound like there's really any positive. It's interesting, Susan, that you quoted from the nurse, because I had the same quote about when it's reported that the patient was moaning and uncomfortable and they had to increase the morphine, right? That the nurse's heart was breaking because the skin was breaking because of this, you know. Now, I think that tells us something about the breaking down the body, especially when the medical staff is expressing that nothing is going to fix it, right? Nothing is going to make this person be better. So these are the harms. And so for the benefit, well, I'm asking, people asking, is a prolongation of life? Well, as we heard, it is a prolongation of life because a person will continue living, okay, in a particular state, okay? But then the question is for what benefit would this person derive? Okay, suppose he does live for another 2 weeks, 3 weeks, a month, whatever, right? What benefit would that person get out of that? Now, if we could ask this person, he might say, yeah, give me another 2 weeks, or try to give me 2 months because somebody's coming into town, you know, my brother from Israel is coming, or something like that. But we can't ask him. So now we have to kind of look at it and say, everything else that we know suggests that, or tells us that, there's no benefit for this person. The only thing that will result is a prolongation of suffering. So when we look at, on balance, the harms versus benefit, right? In this case, for this patient, at this time, it would seem that, even when I look, you know, I was a little worried about the sort of the Jewish law part, so I'm not that familiar with it, and sort of worried, well, is there going to be a big disagreement? And there isn't. There clearly isn't, because everybody is on the same line. When suffering overrides everything else, we need to address that, and the best thing probably would be comfort care for this person.